Well, and today we also have another very special
Yes, we have other guests.
right here next to me. It's my longtime friend, Rael. We go back to third year of medical school, 2003. So Rael is in University of California. He's a professor in psychiatry, and he does research on psychedelics, a very advanced neuropsychiatry and neuropsychology research. So we're going to talk a little bit about that. In fact, you just met with Richard Davidson, the Richard Davidson. You guys were in a meeting together talking about all kinds of cool stuff. So, but before we'll get to that, you know the drill. If you have questions, drop them in the chat. There's a lot going on, as you can imagine. There's going to be a roller coaster of the news for the next 4 years plus, whatever it will be. We'll survive, just like we always did. Updates from my perspective. Doesn't seem like that the hope was that we will see the decline in numbers. We're not seeing it. It's stabilized. In fact, there are pockets of flares. If you look at the news, there are different areas where it flares up probably for reasons which are kind of hard to track nowadays, given that we don't have a detailed statistics anymore. I don't have any updates on the vaccines per se, except to say that if you haven't gotten your updated shot, do it. We're still not seeing flu here. The season hasn't arrived yet, which is great. But you know, if you need to get your flu shot, now is a good time. So with that, and for the wellness topic, it's a surprise since Rael is here. You'll see what we'll talk about. It'll be more like a Q&A. Does that include RSV shots? So my opinion on RSV shots is different. I already mentioned it before. I don't recommend them to people who are generally healthy and don't have lung diseases, even if you're over 70. I don't do RSV recommendation blanket statement for everybody. It is another mRNA vaccine. I'm increasingly getting concerned about toxicities of those vaccines as an autoimmune reactions. There's a pretty significant amount of data saying that, yes, there is an uptick in immune responses. So unless you absolutely have to, if the risk is really high and severe, the reason I'm more careful with RSV, I don't know if we're going to have a season. We didn't have any RSV last year. The shot was given, and great that we didn't have it, but it also means that people who did get it were at the slightly higher risk for problems. So again, I don't give a blank statement. I give an individualized recommendation for RSV, in contrast to old pneumonia shot and old flu shot, that I think everybody should get those. Okay, there is so much walking pneumonia in the region? Exactly, the reason, okay, great question. Could COVID reinfection have something to do with it? No. So walking pneumonias are very common. They sometimes do have seasons. They tend to kind of be more summer, fall, but sometimes they linger into a late fall. The best prevention is a very good pulmonary rehab. So meaning keep your lungs quite active. So today's practice that Michael's going to lead would be really good for that. Qigong is a wonderful method of decreasing risk of getting it, and also recognizing it. It's an easy to treat condition, but you do need antibiotics. So if you have a continuous difficulty breathing and some ongoing fevers, you would want to make sure it's treated and diagnosed. There is a lot of confusion. Some people think they have walking pneumonia, but they have bronchitis. That should not be treated with antibiotics. That's why you have to differentiate. So if you're just coughing, you have a hard time increasing exercise to your baseline, but you generally feel okay. You're not really severely fatigued and you don't have hard time walking. Probably more of a bronchitis, but it's a fine line. You can get easily confused. I have seen people claim they have walking pneumonia just to say that they don't have it, and then antibiotics would be given for nothing. So you have to separate those. That's an important. Benita, I don't track this, so I don't know what % of people got updated vaccine. It's very small. It's less than 30%. I think the uptick of the new boosters have been pretty dismal, similar to the last boosters. The only boosters that a lot of population got was the first booster, the second shot. Beyond that, I think most people, more than 50%, were not getting any additional shots. So, basically you have this long-tailed natural immunity, which doesn't fully protect you, but probably protects you some if you just choose not to do any additional boosters. Otherwise, of course, the booster will protect you a lot stronger. All right. Any other questions? Okay, protocol for the reducing effects of side effects. Yeah, so what I'll do, trying to think how best to do it. Actually, I'll tell you what is the best. You need to contact me personally. The reason is I can order direct protocol for you in 30 seconds. As long as I have your email address, it's very easy. This way you also can get a wholesale discount. Otherwise, I'm a little bit worried because it's quite detailed. I have it set in my ordering system and I can order it for you. Otherwise, maybe what I can do is I can just copy paste the whole protocol and give it to the Janet to post it. My only hesitation there, it is specific brands. We try to be neutral. It's an academic podcast. We're affiliated with the university. We try not to bring specific medications or supplements to discuss. But obviously in clinical practice, I recommend specific products. Okay. What variant? I think it's still the same as the subvariant of Omicron, this newest one. I forgot the name of it already. It's not that important, actually. I don't think there's any other new variants since last couple of weeks when we discussed new variants. XEC? Somebody may correct me. Okay, somebody find the most recent variant that's circulating. It's seemingly the only difference with this new one, I mentioned it last couple of times, there is more GI impact. So more people having symptoms like diarrhea. We see this. There was one variant 2 years ago that was doing this. It's kind of this one. I had 2 patients now with a diarrhea lasting for several months, gradually going away, but very slowly. All right. What's the best way to help the gut recover after antibiotic treatment? Great question. Unfortunately, none. There is no such thing. So if your body will gradually replace the lost microorganisms, but not for everybody. 20 to 30% of people will never recover forever after one course of antibiotics. That's what the data shows. So there is this, that's why we don't have any healthy microbiome in this country. Nobody does. Basically, we persistently going forward, the entire developed civilization has lost a normal microbiome that's well understood. That's why there's this massive attempt at trying to collect and preserve poop from native cultures and try to repopulate the civilized world with those. Unfortunately, that's becoming clear research-wise. The things you can do to minimize problems, you can take probiotics while you're on antibiotics. I do suggest it. I think it's a good idea. Take a broad spectrum probiotic that has at least 10 billion colony forming units or CFUs. Take it 1-2 a day. If you have a more potent product, something like 20, 25, or 50 billion, you can just take 1 a day. If you don't like taking capsules and you don't think that supplements, you think that supplements are the next big evil, that's fine. Maybe they are. Maybe, as my mother-in-law puts it, maybe everything is chipped by Microsoft, and if you swallow or you take a vaccine that now Gates is going to find you and kill you. If you're not my paranoid mother-in-law, then you can make your own choice. But the recommendation is you can take high probiotic foods like kefir or yogurt, and would be a cup of kefir or yogurt a day. Believe it or not, that's highly evidenced. It decreases risk of getting what's called C. diff colitis. Data is pretty good. Beyond that, eat diet that is high in fermentable prebiotics, so the foods that microbes like, particularly things like vegetables and anything fermentable. Things that tend to be fermented means that there's a sugars that bacteria likes. If it's something fermentable, it's probably good for you. Other types of really good prebiotics are different fibers. And the fibers can be soluble or insoluble. You should have a little bit of both, preferably not a little, preferably a lot. If you don't like certain types of fiber and you want to know my favorite, I like 2 specific types. I like ground flax seeds. I think it's a really balanced fiber. relatively neutral, has some fatty acids that are very good. It's also great if you have constipation. And I really like this fiber called acacia. I think it's spelled A-C-A, acacia, C-I-A, right? Acacia. I need to type it to say if I'm correct. That's correct. Okay, Rael says it's correct, so that's good. Acacia. I think that's how you spell it. It's a very low cost fiber. It's one of the few fibers that is safe if you have a bacterial overgrowth or if you're at risk for bacterial overgrowth. That's why I like this kind of fiber. There are some synthetic fibers that some functional medicine docs like. The problem with those is they may be excellent, but they may be a bit pricey. That's the only thing. And if you do like things like psyllium husk, it's perfectly fine. I think that's also a fine fiber. I just think that it's kind of, I actually think acacia is a little bit better and it's priced the same. So it's not any more expensive. That's why I generally prefer acacia over the psyllium husk. Beans, you're right. So of course, I mean, any foods that have good amount of prebiotics would be great as a sort of restorative attempt. All right, so I think we are, oh, perfect, 2:15. All right, so let's, unless there's burning last question. Let's see. All right, acacia you can easily find on Amazon, and also again, if you're my patient, message me and I can put the order for full script for you. I like the powdered. I think I like there's two types, two brands. I think it's okay to mention. One I think is called Protocol that I like for this. I think the other one, I forgot what it was. But if I see the screen that I would recognize. So again, happy Veterans Day. So as I mentioned, Rael is here. He just happened to be here at the conference. So we thought to talk about his topic. So Rael's been in neuroscience research.
He had to talk about my topic.
Yes, I thought of I dragged him into it. He didn't know. He didn't know that he was suddenly going to, he thought he would be relaxing in this nice house, but instead, post-conference bliss. So, Rael, you've been studying neuroscience, particularly effects of psychedelics on brain and kind of as a tool of prevention of depression. You just mentioned to me that we have 22 vets dying every day from suicide, completely preventable, often ignored. Society is not doing enough. What are you doing? Just tell us in terms of your most recent research, some of your projects. Just talk. This is very interested public. They would love to hear what you're doing.
So I'm going to give a word just to kind of place myself in the world a little bit, so you know where I'm coming from. I am a physician psychiatrist at USC now. I've been in academia for a long time, which is a little bit ironic, given that academia doesn't always feel like a natural place for me. And you know, I think the same could be said about Misha here.
Yeah, it's kind of shocking to stuck around.
I know. So. But I did the kind of full bore MD and PhD route with the PhD in neuroscience. My PhD research, actually, I was involved in that when Misha and I met for the Humanistic Medicine kind of action committee of AMSA, the American Medical Student Association, back 20 plus years ago. Mm-hmm. And my research that I was doing then, I've kind of continued in that vein ever since, just getting more and more clinically relevant. But basically looking at how the brain is changed by meditative practices, and also comparing and contrasting how the brain is changed through the use of psychedelics. And then, of course, the primary interest is not so much the brain, it's about consciousness and the lived experience for human beings who are doing these things. But through using science to quantify those kinds of changes, knowing that this would be a way that society might come to integrate such experiences and perspectives in a fuller way. You know, the 60s kind of tune on, turn on, tune in, drop out didn't quite work in any way that impacted, you know, everyday people and government, etc. So kind of using the lens of science in the same way, you know, we are doing within the integrative medicine approach to get at something approximating healing instead of symptom management and kind of symptom focus. So that path has brought me to continue the work on both the meditation practices. I'm the director for the Center for Mindfulness Science at USC, where you know, we've done our best to bring more awareness of the multifactorial impacts of meditative practice on, you know, everything from genetics to social functioning at a cultural level. I happen to have gotten involved in this DARPA-funded project a few years ago, which is what brought me to town.
And DARPA is?
And the DARPA is the Defense Agency Research Projects Administration. So it's essentially a funding agency within the Department of Defense that has broad latitude to fund things across many different domains. Yeah, they do some in the more tech kind of sector, and they were the ones who funded the initial thing that became the World Wide Web that we are using now today to communicate. But they've also funded quite a bit of biomedical research over the years, and they have kind of an ongoing, that's a sustained efforts in the mental health arena. The program officer who developed the specific call for proposals that I responded to with some colleagues at USC is an ex-military himself, an ophthalmologist named Rig Whitcop, and he has developed a portfolio all in the mental health space and really aimed at addressing his personal alarm at the reality of you know, the poor mental health of our nation, and in particular also of the military personnel, which, you know, as many people here may know, the suicide rate within veterans has been growing in a pretty alarming way over the last decades.
And yet they have zero access to any psychedelic medicine, which are pretty much at this point clinically proven to be effective antidepressants, except I guess for ketamine. But even ketamine, they don't have easy access to, my understanding.
Yeah, so that understanding should be updated.
Oh, good.
Because it turns out, yeah, there's so first, just to kind of make it clear, my particular study that I was, you know, kind of speaking about at this conference in DC the last couple of days was really on Thursday, yesterday. That study aimed to use psychophysiological monitoring while in a laboratory environment in a way that hopefully can be kind of compacted and, you know, made super transportable in a way that could be, you know, in any doctor's office one day. But for right now, we're like using the big equipment that is not so portable and could not be done in any doctor's office, but measuring, you know, things like eye movement and pupillary constriction dilation and facial expression and EEG and galvanic skin response, EKG, in response to stimuli that are aimed at eliciting, you know, depressive and or suicidal cognition versus kind of neutral positive cognition, and seeing whether some combination of those psychophysiological markers are possibly, you know, some combination might be fully able to predict whether somebody's suicidal in a way that could be helpful, especially in the case that somebody's not wanting to talk about their suicidality, which is often the case within some some populations of society, especially if their job depends on not being seen as weak or suicidal, you know, like a military personnel. So yeah, we did find some promising findings there, and the next phase of study is going to be more devoted to seeing, how we can reduce the number of sensors and the kind of transportability to make it more realistically something that could be used in a clinical environment. And we were amongst a group of 4 different teams around the country who were doing that. So we have some, interesting possible collaborations to come, kind of seeing which of these insights and approaches could even be combined. And then Richie Davidson's group was there speaking about another set of studies that are being funded by DARPA right now, aimed at quantifying mental health and interacting with mental health through kind of ecological momentary assessment, this EMA technique that's being more and more used in behavioral research. It essentially involves, pinging people on the cell phone throughout the day and getting reports, and not just, a button press of like, how are you feeling? Although oftentimes that's a little part of it, but oftentimes speaking to your phone about how you're feeling and quantifying, there's all this growing research that is showing a great capacity to accurately describe people's affective state just by the tone of voice, the different measures that can be extracted from the audio signal of the voice, and then pinging people with little short exercises that are like a minute, 2-3 minutes, if there's some signal that somebody's kind of going into a state of distress or distractibility or dysphoria. And so it's an interesting, current area of research that's going on. And then another that he's collaborating on as well, on these interventions aimed at stimulating the brain, not through a psychedelic or a meditative practice, but through an actual, electrical or magnetic or ultrasound kind of input. And in particular, and I'd never heard of this area of research before, but there's some promising things happening there. Stimulating in order to promote deeper sleep and more REM sleep in particular. REM sleep is one of the first things that starts to suffer when you go into distress and or clinical depression, and trying to, increase and successfully showing it's possible to increase how much REM sleep people get by stimulating the thalamus at a very specific time in the pre-REM sleep cycle. So some of the findings
so you think that we could, in a foreseeable future, accurately identify vets, or actually it doesn't even have to be vets, it could be anybody who's at risk, and maybe the equipment can get so simple that it would just be your cell phone picking something up and saying, look, you gotta get checked out right off the bat if you respond a certain way to the phone.
Yeah.
Realistic.
So this is the
realistic. Huh.
How realistic that is at a global level within society is something that I do have questions about. And I'll come back to that, but first answer your other question, which I put to the side, which is, or a comment about veterans not having access to psychedelic therapies. And yes, it's true that active duty military personnel are not yet having access to psychedelics when they get distressed, depressed, or even develop PTSD and are still active duty, which is a quite common phenomenon. It's not something you just develop after you get out of the military. But the interesting thing is, DARPA's funding psychedelic research as well. So DARPA's only about funding stuff with an eye towards active duty people. The VA funds the veteran specific research. And B, the VA is now, a number of VAs are now running these trials for depression and PTSD, depression with psilocybin and PTSD with MDMA. And, speaking to people who are really aware of the landscape at the funding level, a lot of them are really of the impression that while the VA was very reluctant for a long time, well past the evidence was starting to be clear that for PTSD, this may be the most promising type of treatment might be something like MDMA and or group treatments with ayahuasca, that kind of thing.
So it's not totally
they're now
crazy.
They're now
they're actually talking about. They're actually trying to.
They're doing it.
That's exciting.
Yeah.
Yeah, I have not heard this. I just presumed that because
it's primarily from it's from private funders have given big money to local VAs near them that are now running these trials. And yeah, the controlled substance nature, I met a guy last year. I just got an invite to go back to another event that he's putting on, but was a fellow by the name of Jesse, might be Gould, who started the Heroic Hearts Project, which is he's a veteran. It's a collection of veterans who found deep healing, and basically, their lives were saved by their experience with psychedelics. And so they started a foundation to raise money for others, vets, to have access. And a big part of what they do is just giving vets, who don't always have much money themselves, like access to go wherever they can do it legally. And then they also are starting to fund research. And so, that is simply one of the major players at the level of, why psychedelics are getting closer and closer to, being embraced by biomedicine. Biggest part, they're clinically efficacious. But in terms of what got society to get over the kind of stumbling block around, the fears that the 60s will happen again, and or people just start using drugs and drop out, and it has to do with it does have to do partly with this movement within the veteran population. They've been demanding it, and politicians have started saying, hey, we're not going to keep on ignoring what the veterans know that they need. Yeah, so it's a group of money, $10 million. I found about two things that are relevant to this. The Defense Health Agency, which is also under the DOD, but not DARPA, had $10 million earmarked by Congress last year that they had to spend on psychedelic research. Wow. Some congressmen said, you got to go spend this 10 million on nothing else, just psychedelic research. Wow. So that just happened. And then, the fact that what I want to get back to is what you said about how realistic is this kind of, device-based kind of monitoring and intervening in everyday life. And, there are some people who are quite happy to wear an Aura ring, or even something more like, around
right here.
Exactly. Or even like a headband, right?
Can't easily take it off, but right here. Yeah.
And there are others who, especially as that kind of technology might grow, may become more and more like turned off by like some kind of, nanny state, or, like Big Brother watching me.
My mother-in-law, she's not gonna wear that.
And no matter, if you have to, it's an interesting thing, I would say, is that you have to feel some level of comfort with your interconnectedness to embrace that to begin with. And the issue with suicidal, the whole domain of suicidality is very much about the experience of disconnectedness, and the experience of like, nobody can force me to be connected because I'm not connected, and I'm not going to put a ring on so somebody gonna watch me. I'm over here. Yeah. So there's a kind of just the reality of human suffering. I don't think is so simple as to be really addressable by that kind of like, oh, everybody's going to opt into this thing and it'll be a shiny, happy world, So, and that's where I think, my own interest in the work with meditation and psychedelics over the years has always been informed by the sense that, we need a very deep transformation at the level of our common consciousness and our experience of our interconnectedness, and not just at an intellectual level, but at an experiential level, that you know, it's not going to, yes, maybe there are ways for technology to somehow assist, but it's not going to be the driver. That's my own sense.
All right. Well, let's have maybe there's one or two questions to Rael, and then we'll move on to do our practice with Michael. I see there's some clasping going on. Elisa liked Rael. Maybe we'll have him come back from home at some point and talk about something. Oh, I think you're on. I think you just got hooked into something you didn't know you would be. All right. Yeah, so unfortunately, some of the psychedelics, they're still considered illegal, and people do have to explore and go elsewhere. Vinisha brought up a point that some people have to travel outside of the US to get certain things. You know, anytime, and that's the big problem. I mean, the psychedelics, except for ketamine, are all considered what's called DEA Schedule 1 controlled substance, which makes them illegal in every state. And even if the cannabis gets approved,
they're technically illegal at the federal level in every state, but it's important. You know, on the East Coast, you guys might not be fully aware of this, but you know, in Colorado and Oregon, state has legalized the access to psychedelic plants.
Right.
Just in the same way that marijuana was first legalized in those two states. I mean, you know, marijuana was the gateway drug for this, I think.
Right.
And so,
well, and generally, I think there's such a laxity. I have not heard from any of my colleagues, and if you have, somebody getting prosecuted for home use of psilocybin.
No, actually, I haven't. Yeah, that's true. I think there's a federal laxness that, despite some fears that I have and many people might have about the coming administration, if, you know, there was not a cracking down on it last time under President Trump, and if he gets his way with RFK, which has all kinds of pluses and minuses, that one of the highest priorities that he's put out there in his plan is more psychedelic research.
So maybe we'll see more of this. So. All right. Well, with that, Rael, it was so great to have you. You're still here. Let's transition to Michael. So I'm going to try to do this since we're all in the same space. I'm just going to turn the screen. Mish's going to sit over there on a chair, and Rael and I will probably just be behind there and doing it with you, still in the same space. So thank you. And of course, you guys, Michael's been here with us many times. He's my personal longtime friend. Sometimes I call him my dad, well, spiritual dad. So it's wonderful that he's here, and we are here for a great practice. And let us know if there's any sound problems, since I can't monitor now the chat. I hope that you'll be able to, if you guys have any questions, maybe Janet can help. I'm gonna put you, make sure you're on spotlighted. Okay, that should be good.
Thank you. So today we'll, for some of you who has done some Qigong before with us, or maybe in some other places, there will be a continuation of our study. And for those of you who've never done it before, it's fine, because there is no experience necessary for this little class that we're going to do. So Qigong is sometimes called Qigong and vice versa. I guess it's just a question of preference, how you pronounce Chinese words. And generally, it's considered to be a practice of studying, becoming aware of the energy in the body, then learning how to move it in a specific way, and then cultivating it in a specific way that people kind of use to do all kinds of things. Because the term Qigong basically was introduced into the Chinese culture sometime in the late 40s of the last century. And it has so many different variations of practices that it's almost impossible to fathom this whole scope of things that various kinds of so-called Qigong would do. It's sort of like coining the word medicine, just for the sake of comparison. The word medicine, imagine if it was just coined in the early 50s. And it has so many different varieties of all kinds of sometimes seemingly unrelated things that it's almost impossible to kind of draw the baseline. Same thing is here with Qigong. We have philosophical Qigong, healing Qigong, Taoist Qigong, alchemical Qigong, well-being Qigong, and it continues longevity Qigong, etc. There's so many different things. But the one we're going to kind of tackle today is so-called Jingmen Qigong, which is the wisdom healing Qigong. And it's an interesting kind of Qigong because it heals our being with wisdom. And that might sound like a very lofty type of undertaking, but on some level it's very simple because the wisdom healing Qigong harmonizes action and connection to the world, emotions, also a type of connectivity energy with the world, and the cognitive domain or the mind. So action, emotion, and the mind come into harmony. And of course, we're all familiar with psychotherapy that sort of attempts to do the same thing through very different protocol. But Qigong is a very technical type of art and science that does this type of harmonious balancing in a very different way through basically energetic alignment of three energy domains in our body, which are called Dantian. There are three of those. Lower Dantian is located 2 fingers below the navel. Middle Dantian is located in the middle of the chest. And upper Dantian is located there in the head, some place in between the ears. So lower Dantian is responsible for action, middle for emotion, and upper for the mind or cognitive domain. I would also say that this is an oversimplification of this whole art, but for the sake of today's class, I think it'll do. So let's try first to look into our body, and there is an interesting thing inside us, which is called subtle body. And not to make it too esoteric, we all know about it and we can even experience it. So right now, just look within. Look within your body with your mind's eye. And looking inside, you will find an empty space. Not the muscles and ligaments and bones and organs, no. It's sort of like an inner, empty, very much alive domain of energetic presence. And if you look into it, you will see that there are all kinds of sensations in there that the subtle body experiences. For example, touch, as we experience it through our hands and feet on the floor, and our body touching the clothing. And it also experiences all kinds of other things. And it's a seat of our somatic intelligence. Sort of the first language that we have is a somatic language. And so inside that subtle body, there are these 3 dantian. And so the lower dantian is located inside the body, not far from the spine, about on the line that's coming about 2 fingers below the navel. And you could put your index finger in that place and rotate it slightly, kind of sensing and trying to connect with that lower dantian within the subtle body. And as you rotate your finger a little bit, you might feel some kind of a interesting response there. As if you're touching something without really physically touching. And just to compare the sensation, try to do the same thing on your forearm. And you can see the difference. I hope. And so there is one below the navel, and you might feel some kind of connection there. There is one in the middle of the chest, and it's deep inside there also. And you might feel also the response there. Some kind of sensitivity, something that you cannot put into words. And you can also touch the third eye and very gently rub it with the middle finger and feel some kind of response there inside your skull in the subtle body. And if you need to feel a difference, you can always rub your forearm or your shoulder and just see what I mean. So these 3 dantian are situated on the central channel which connects them. It's a basic energy pathway that comes from the perineum all the way through the body and dantian and exits the skull here at the crown of the head. So it's like an energetic sort of an elevator, right? Okay. And so look again back into your subtle body and just remember it the way it is right now. We haven't done anything yet. We just became aware of it. Just look at it, register. What is it like right now? How am I inside my body, inside my emotions, and inside my psyche? And take something that I call an inner photograph, inner snapshot. Just remember that as a stage 0 snapshot. Next thing we're going to do is we're going to smile with our face, our lips, eyes, forehead, palms, soles of the feet, and the whole body. As if everything is smiling. Make sure you have a little smile on your lips as well, sort of like Buddha or Mona Lisa type smile. And you can increase that smile a little bit on your face. See how body reacts. And then decrease. And adjust it to the level of somatic physical joy that's optimal for you right now. And look at your subtle body, at the change that you just elicited with your smile, and compare it to the initial snapshot. Note the change. And open your feet and soles of your feet as if they were flowers, like opening into the ground and rooting with lots and lots of fine roots all the way down into the ground. And do the same thing with your hands, with palms of your hands, as if they were like flowers, opening up and falling. And do the same thing with the crown of your head, as if it were like a sunflower opening in all directions, all the way. Keep smiling. And now we're going to do the first Qigong exercise, which is called spinal breathing. As you inhale, your head goes up and spine slightly stretches physically. And when you exhale, everything relaxes down and relax your spine and it settles down. When you inhale, and the spine stretches like a rubber band a little bit. As you exhale, it goes down, relaxes. So as you inhale, bring the energy flow from the earth through your feet, through your legs, into the lower dantian, right there below the knee. And as you exhale, feel how the lower dantian expands, smiles, becomes warmer and shining like a little sun inside your body. So there's a little bit of visualization you can do, or you can just feel how energy moves in your subtle body, if you can do it. So the stomach inhales, you breathe into your stomach, and then exhale. So now continue breathing in, and when you breathe in, the energy comes from the earth into the lower dantian, but also comes from the sky with the open crown of your head all the way into the lower dantian as you breathe in. And when you exhale, this energy is mixed, and dantian expands even more, becomes brighter, warmer, happier. And now we can rest and look back into your subtle body and see what kind of changes do you have on the level of bodily sensations, emotions, and your thoughts and cognitive domain. Keep smiling. And compare that inner snapshot with the very first one that we did. Just become aware of the change, if there are some. And the second exercise we're going to do is called pulling, pushing movements. So we bring our hands like so, and raise our palms a little bit. So we go back a little bit like this. And at first we lower the palms and open our hands a little bit like this, so the fingers are a little untamed. We're looking forward into the horizon. And imagine that your hands are infinite length. Just sense that infinity going over the cities, lakes, forests, fields, all the way into the cosmos, into infinity. Touching stars, galaxies. And as we breathe in, we bring energy through the fingers, through the hands, through the arms, into the lower dantian, and our hands are traveling like this. And exhale like this. In. And out. In. You bring energy all the way into lower dantian as you breathe in. As you breathe out, you push the energy along the central channel into the middle dantian and the upper dantian, harmonizing and equalizing energies in these three domains so they all equally. And since the camera distorts my hand movements, they look like one is higher and one is lower, but really it's not. You see it in a different way so you can see it. For some reason, there is a little distortion. So don't pay attention to that. And you breathe into the lower dantian, breathe in and breathe out into the middle dantian and upper dantian. And equalize the energy. Harmonize. Keep smiling. And lower your arms. And just relax. And look into your subtle body. Become aware of the next change that happened. And again, compare it with the initial snapshot that we took. Become aware of what kind of changes you sense. Try to articulate them so you can understand the exact scope of these changes. Keep smiling. And now, if anyone has anything to share, sort of like just a few words about the change, you could do so we can all hear what you've experienced.
I'm very aware of my heart and how it's more relaxed than when we started. Like it's paced a little slower, but it's not just the pace. It feels like it's not like every time I tune into my heart quite often, I would not necessarily get anxious, but I would just feel a bit. I would feel the stressors. suddenly I don't feel that. It feels very peaceful.
Thank you. Anyone else?
I'm feeling calm. I feel much calmer than I did when I originally started. And I like the fact that I can make all my body parts smile.
And
so thank you.
You're welcome. So this Qigong is great also for treating PTSD, depression, and all kinds of other things. So it could be a good thing to explore in some kind of academic research as well. So anybody else wants to share anything?
Yes, I felt the first part was very, the first exercise was very releasing. And I felt like it moved a lot of energy, and I felt the energy moving out of my body, off through my head. The second exercise was hard for me. And that's because with long COVID, I just have trouble keeping my arms up, doing anything of that level. So I eventually stopped, I guess about 2/3 of the way through. So I felt different from each one of them.
Thank you. You can do that second exercise just 3 or 4 times at first. And that's enough. And then as you get used to it, you can do a little bit more if you want.
Thank you.
So our time has come to an end, unfortunately, and we've just touched onto first 2 little introductory exercise of the whole Qigong routine, which is altogether is about 45 minutes. So if you're interested in studying it, just email me and we'll see what we can do. Thanks very much for inviting me again to see all of you, and thanks, Misha.
And thank you very much, and thank you, Misha.
Janet, who do we have next week? We still have next week. We don't have a class the following week because it's Thanksgiving.
Yes. So next week we have Julie Wen and Dr. Elva Anderson.
Yay!
We'll be back with laughter yoga. So for those of you who may not have read what I put in the chat, Julie is a integrative nutritionist. She was formerly with the GW Center for Integrative Medicine. So there are those of you who may know her, but like I said, if you have any dietary nutrition questions, come with them next week and ask Julie all. Anything else, Misha?
No, I think that's yeah. So I think I have to end on time today. So because we have a meeting.
Okay. All right. Happy weekend, everyone. Bye-bye.
Bye.